What's going on, everyone? Happy Tuesday to everyone. Hopefully it's been a safe day so far. Hopefully if you had to take a COVID test, you were negative. Started off today with India. Active COVID cases in the country dipped to 63,380. New Delhi, India has recorded 6,660 new coronavirus infections, while the active cases have decreased to 63,380, according to the Union Health Ministry. The total death toll in the last 24 hours is 24 deaths. So their cases, it would appear, as of right now, their cases are dropping. But again, we're not going to call peak on India until the end of this week. We want to be absolutely sure that their cases are on the downtrend. Now, moving on to our next story. Sam Smith postpones another Gloria the Tour gig, canceling Birmingham show just hours before as they fight mystery virus. There's no word on what the virus is. It's just another one of those. It's a mystery virus. Alrighty, Julia Saccone's Guerrero d'Italia hopes hit by COVID-19 positive. He was supposed to be in a cycling competition. However, he didn't get to do it because he did test positive for COVID. Moving on to our next story. Harry Belafonte, who was an activist and entertainer, has died at 96 years old. If many will know him, he was big into music, but he was also a pretty big activist as well, and sadly, he has passed away. You ever hear the song called Day-O, Day-O? Yep, the Banana Boat song. That was him, Harry Belafonte. So sadly, he passed away today at 96 years old. Our next story is about long COVID in children. It still poses plenty of questions. And this is from the American Heart Association. So yes, this is not good news at all. If we read some of this, basically it goes on to say it's a very difficult collection of symptoms without a clear single treatment. That should be alarming to you. Let's read that again. It's a very difficult collection of symptoms without a clear single treatment. No treatment, said Dr. Sarah D. Ferrante, a pediatric cardiologist at Boston Children's Hospital. I think it's particularly difficult for parents to help their children with this because it's hard to figure out what symptoms are related to COVID versus other illnesses, and because long COVID in kids is different from long COVID in adults. Long COVID is still long COVID. What I mean by that is it still affects your ability to do the day-to-day activities, whether you're an adult or a child. And in the case of a child, it makes it harder for them to get a proper education because, it's harder for them to learn. It's harder for them to concentrate and focus on the proper things that they need to do when they're in school or even day-to-day activities at home. So it's rather alarming that we don't have much in the way of treatment for long COVID in kids. It's concerning. We're starting to see a few treatments pop up in adults, but nothing that's set in stone. And it's even more difficult for kids, and this does affect many kids. I mean, we're essentially sending kids by the masses back into schools with no masking, with all these mystery viruses going around, COVID wrecking the immune system, and we know by immune systems being wrecked, it makes you more susceptible to viruses, and, viruses galore go around when you're in school. Kids get sick and they have a more difficult time dealing with these. So yeah, this is something that really needs to be addressed as soon as possible. Moving on to this, here's something to be ticked off about. Tick-borne illness continue to rise in Michigan. Health officials anticipate another bad year. And yep, ticks are something that is really starting to get worse than they used to be. I live here in Pennsylvania, and I can tell you, there are more ticks in my state than I have ever seen before. It's just totally unbelievable. If you have a pet or something, be careful. We have a cat. Just the other week, we let our cat out, and it came back. It had not one, not two, not three, 4 ticks on him. We had to pull the ticks off, and right off the bat, we bought some Frontline Plus. And it can be just as bad in adults as well. In fact, ticks can lead to Lyme disease, and a whole bunch of other illnesses as well. Now listen to this. According to the CDC, Lyme disease and other tick-borne illnesses continue to spread across the northeast portion of the country and in Michigan. Let's move on to our next story. We're staying with ticks for a minute here. Ticks are rapidly expanding in Ohio, and more bad news about the disease taunting blockbusters. So yeah, this is bad. And read what someone says here. Ticks get a little worse, it seems, every year, says Tim McDermott, DVM, Agricultural and Natural Resources Educator with Franklin County Office of OSU Extension, Ohio State University Extension, and a veterinarian. Then it says here, what we have had here in Ohio is a rapid expansion of the number of ticks of medical importance for humans, companion animals, and livestock, going from one about 15 to 20 years ago to 5 now, including 2 new ones in the last couple years. So yes, different diseases and what can happen with ticks, it's getting worse. I do know here in Pennsylvania there's a new type of tick that's out, or a new type of disease that's coming out. I don't know the name of it, but I've heard about this in Clearfield County, Pennsylvania. It's pretty bad. I actually have a relative who got bit by a tick a few years ago. I believe it was just before the pandemic started. And yeah, they were bedridden for 8 months because of the tick bite. I don't know if that was the new illness that's coming out of Clearfield County, but it was in that area, so yeah, it's something we have to keep an eye on. And finally, we do have this before we get on to the data report of our report today. 82-year-old Bob Knight released from Indiana hospital after an acute illness. Legendary Indiana Housers men's basketball coach Bob Knight was released from the hospital after dealing with an acute illness. So it's good to see that he's out of the hospital. And again, this is a basketball coach out of Indiana. Taking a look at today in COVID history, we don't have anything in COVID history for today, so I would just like to remind you that though we look at COVID history, or pandemic history, whatever you want to call it, that is something that's still evolving. New COVID variants are still generating on the regular, and the pandemic is still ongoing, so history is still being made for as long as we allow this to continue to spread. Taking a look at the latest wastewater, you can see nationally, we don't have any regions that are rising right now, so that's some good news. And taking a look here at the wastewater charts, we'll just do a couple counties here, a couple sites, a couple states. New York State, here's one that's rising. Wayne County, New York State. Here's a rapid rise. Only 8,931 people serviced by this watershed, but it is going up. And we do have a red watershed now in northeast Ohio. This sewer shed has 12,000 population. And wow, look at that. It's really starting to go up. And just looking at Ohio in general here, it would appear to me today there's a few more orange moderate to high sites than we've seen over the past couple of days. Here's Crawford County, 12,362. Here's one down in Fayette County. That's dropping, but here's another one. Conshohocken County. I hope I'm saying that correctly. There's a good chance some of these counties sometimes I just can't pronounce them correctly. Apologies if that's the area that you live in. Sewer shed population, 12,000. And again, that one is rising. Look at this one. Ottawa County, Ohio. That's rising as well. So some concerning trends in Ohio. And anytime we see concerning trends, we have to concern ourselves with the possibility of a new variant forming somewhere within this. Alrighty, zooming out here, we'll do one more area here. Taking a look here, Nebraska still has some moderate to near high transmission. The rest of the country is not doing terrible. What's this one right here? Let's see, there's a red one here. I think this is new. Oh yeah, take this out. Hempstead County in Arkansas, 10,500 population. Wow, rapidly going up. So I think we're probably going to do a wastewater update video in general at some point later this week. It'll just be nothing but wastewater. And remember, we're also going to be doing our volume 2 or second edition of staffing shortages. That's coming up probably, I'm thinking maybe tomorrow, but we'll see. Taking a look here at the latest community transmission map. Remember, this ends on May 11th, so we don't have much longer with this tool. High transmission. 671 counties. Substantial transmission, 468 counties. Moderate, 1,393 counties. Low, 591 counties. Taking a look at the latest variant proportions, XBB.1.5 is still the dominant variant at 73.6% of the cases. XBB.1.16 is at 9.6% of the cases. XBB.1.91, 7.9%. XBB.1.92 is at 2.9%. XBB.1.51 is at 2.2%, and FD.2 is at 1.6%, finally followed by XBB at 1%. Taking a look at BNO, we do have a couple things to show you here, and there was a weekly update that was added the other day. We did not get to that yesterday. The weekly update was last week, 99,640 cases. The average is 121,763. That's down big time by 9,585. States reporting 47 out of 50. In hospital, 14,654. And remember, this was as of last week. So we're mainly concerned about cases and deaths here. New deaths last week was 1,192. That brought the average down to 1,595. 3 states did not report last week: Florida, Iowa, and Mississippi. Iowa has not reported anything in nearly a month. They've stopped reporting. Florida still has an issue. I don't know what the deal is with Mississippi. And remember, Iowa became the first state, U.S. state, to end COVID-19 reporting. Utterly ridiculous, but again, I'm not trying to be political here, but they are a far-right state, and we tend to see the far-right states not care too much about the coronavirus. This was the update for yesterday. There were 8,454 new cases. States reporting there were 7 out of 50 in the hospital. 13,927. That dropped by another 727. ICUs yesterday were at 1,828. New deaths, 150 were added yesterday. The average is 169. That's down by 1. Again, as I just noted, Ohio, we're seeing that concerning trend in wastewater. So Ohio cases may start to rise, and you know what? It's not a surprise. We were due to see somewhere in this country start to rise soon. It was only a matter of time with all these states dropping. I mean, here's another example. New Jersey. Wow, just 52 cases yesterday. Now, that does not include at-home testing. That does not include, I don't think that includes reinfections in New Jersey. And antigen testing, so they include a few at-home tests, but 14, a few antigen tests that are not PCR testing. Lab-confirmed deaths, 3. Hospital deaths, 6. Let's move on to Pennsylvania. Center County, Pennsylvania, the only hospital in Center County. They had just 3 hospitalizations yesterday. Lowest number in a long time. That's good to see. Taking a look here at New York State, 380 cases reported in the last 24 hours, 1.3% positivity, 1.5% is the 7-day average. Hospitalizations in New York State, they continue to fall. 648 in the hospital. ICU, just 89. Moving on now to some international data real quickly. South Korea is up 18% on cases, up 16% on deaths. India's up 6% on cases, 43% increase on deaths. Japan's up 19% on cases, 8% on deaths. France is down 8% on cases, up 59% on deaths. And then coming down here to Vietnam, it's still a 244% rise. They did have just 1 death last week. And scrolling down here further, Romania, 170% increase in cases, 15% increase in deaths. There is a disclaimer. A lot of these countries, or some of the countries I should say, are not rising because of the XBB.1.16 variant. More so because of other variants. Some countries like Vietnam, I believe, is one of the examples. XBB.1.5 is actually what's causing their surge. Here's the Philippines. 22% increase in cases, 81% decrease in deaths. Again, I don't believe their rise is because of the XBB.1.16 variant. Alrighty, that does it for today's pandemic update. If you like this video, give it a thumbs up down below. If you want to see more content like this, subscribe to my channel down below. And remember, we do have another channel called Climate Data Report. I put the link to that down below, where I do weather updates, and we'll probably do a weather update on that this evening because there's a stormy setup brewing in the Northeast. It's something that needs to be reported on by me. So I will see you all again next time. However, until I see you again next time, you need to do 2 things. You need to test negative, not positive, And stay safe, everyone. Have a great afternoon.